Hmm. So the slide is also visible, I hope, right?
Yes, sir.
Okay. So the medical college in which I am part of is Dr. Bidhan Chandra Roy Multi-Speciality Medical Research Center. It's a big name, and in Indian Institute of Technology Kharagpur, it's a first of its kind technology-driven medical college where technological innovations are, I mean, engineering and medical science goes hand in hand. So before going into the topic, right? So this is a broad general terminologies by I mean regarding which I hope most of you are familiar. Dekho, we are not here to mug the subject, right? But we are here to understand some concept, and I'm sure by the end of this class you will understand or learn something new, so that number one you can write your answers. अब कहाँ कहाँ क्वेश्चन आ सकता है इन ऑल द डिसिप्लिन्स बिकॉज इज द जनरल मल्टीडिसिप्लिनरी हेल्थ केयर टॉपिक राइट सो यू कैन फेस योर क्वेश्चन इन एनी डिसिप्लिन in second professional MBBS and in any professional descriptive exam for that matter. Long question, short note, a teacher can feel like you are very tech savvy, he can ask 2 or 3 questions from AI in your viva. And even better, if you are now going for the competitive exams even in Marrow etc, you will get MCQs related to this, right? So aisa nahi hai that okay chalo AI ho raha hai to whatever, you should pay attention. My point is that, so there are few points regarding which the basic terms which should be clear to start with. Now there are few terms which many of us use interchangeably and lightly, thinking that one leads to the other, right? Full form most of you must be knowing. AI stands for artificial intelligence, ML is machine learning. What is DL? L तो learning, D for deep learning, ठीक है? NLP is natural language processing. Now you can see in this Venn diagram ये वाला figure में, so AI is the everything, anything in which human being is depending on the machine, or the machine is doing something without any human intervention, minimal human intervention. This basically comprises of the whole AI, the blanket term. Now machine learning, natural language processing, ये सब are constituent of the AI. So whenever we are talking about ML, definitely there is AI. So you might be hearing the terminology, बहुत सारे courses बिकते हैं AI and ML, wrong, ठीक है? आज से बोलना कि you are teaching wrong number, because ML means it is already AI is there, right? Anyway, so if we look at the history, we don't need to know much right now. बस इतना ही जानना है, at 2020 most of us are already using the GPT stands for general purpose technology, right? And one of the thing that you use is chat version of that, right? Anyway, so going forward, if we look, so nowadays in today's date, this AI, AML, deep learning, natural language processing, large language model, chat GPT is not a big deal, because we are used to it. Because we are used to it, it will be easier for you all to apply that visualization, that concept, in understanding what can happen or is happening in medical science, in healthcare, in clinical laboratory, in research, right? So देखो, real world AI application, ML application, deep learning, कुछ भी. So you all are familiar with this, fine. So whether it is fraud protection, giving a QR code against which you are paying in your UPI app, whether there is a self-driving car which is or is aeroplane on an autopilot, whether you have ordered something on any food ordering app, and the next time the app suggests you, okay, you like this, or based on your area of location you might like this, right? So कोई भी show, nothing, I mean anything, be it any show, in even the face unlock in your phone is actually AI, right? This AR emoji, fine. Everyone now posts their personalized stickers on social media. Nothing but artificial intelligence. So now game AI, definitely you are shooting a opponent, the opponent doesn't stand like this. Okay, it definitely it dodges, and you need skills to kill the character or NPC in the game. Okay, na? So if we can relate to all of these, then already topic is half done. You can now extrapolate or visualize the same thing, that is these possibilities that are happening, and apply it in medical science. Fine. Now finally I'm coming back to my topic. I am a faculty of biochemistry and laboratory medicine. So basic thing that happens in laboratory testing. How many of you have been to your central lab, the university building, outdoor cafeteria ke bagal se? If you go, you will find in the ground floor there is a lot of patients flocking around near the skin outdoor, and there all the blood samples, all the urine samples, sputum samples, everything, tissue samples are being taken and analyzed, right? Since you have already been through first year, you will find Kajalda working over there, right? Anyway, so the basic thing that happens traditionally is we have a patient, he or she is examined, right? There are some pre-examination procedure that is to be done, mainly the collection of sample, right? And then the sample is transported to the laboratory. The laboratory personnel does the analysis. The reports are sent to the clinician who ordered the test, and then the clinician examines, and then some decision is taken. Fine. So among all of these, ye sab mein there are multiple steps that are involved. Alright, so you can read the names, and thing is, when I tell you to write, do write. Of course, I will be sharing the presentation with Ashita Sir, and there every one of you will have access to this. So don't write mindlessly, but there are something which is not in this slide, and then I will tell you likho. Then you should take a note, right? So there are multiple processes. So specimen collection, identification, preparation, specimen delivery, loading, aspiration, these are all things that routinely happen in laboratory, right? So how can we, so our topic is AI, right? Artificial intelligence. So in order to implement artificial intelligence, we need to be intelligent, right? तभी ना artificial आएगा, पहले natural intelligence से काम करना पड़ेगा. Then how we make this thing intelligent? We change this workflow traditionally to automation. So that is the first step in implementing artificial intelligence. So पहले automate the things, whatever you are doing manually, first automate it, and then let the machine ease your job. Mind it, we are not letting the machine take over. So a common topic is debated and has been debated, will machine replace doctors, right? So we are not going into that domain. Of course, this is a hand in hand job, handshake, right? So machine is, we are lending one hand and machine is also lending its another hand, and we are shaking to make the process more efficient. So these are all the steps which have been automated, and now AI have been implemented in all of them. But naturally, this is a lot to take in one class. So I will be only highlighting few areas which will be interesting for you all to relate. Okay. So the first thing I will start with is specimen collection. Okay. So phlebotomy, you all understand? Phlebotomy means, phleba means vein, and otomy means, yes, pricking the vein. Now, okay, let me digress a bit. Otomy, you all have started surgery word by now. Otomy means there is a cavity and we are cutting into it, right? Phlebotomy, gastrotomy, anything, kuch bhi. There is a cavity and we have opened the cavity, right? Otomy. What is ostomy? Ostomy means there is a cavity, we open that cavity and then we connect it to the environment. ठीक है ना? So एक channel, pipe बना दिया. So colonostomy, right? Or colostomy or tracheostomy means we are connecting a pipe from that organ or from that hollow chamber to the outside to collect anything, whether to exchange air or to collect any sample or specimen or draining fluid जो भी है. And what is ectomy? This is easier for you to understand or relate. काट के निकाल दो. So tonsillectomy means removing the tonsil. Why I am discussing all these terms? Because later when you will be having integrated classes and surgery department will come to play their role, you will find a lot of robotic surgery that are implementing AI and ML are doing all these things only. So otomy, ostomy and ectomy are the ones that have been mastered by robotic surgery, and they are a big part of AI and healthcare. Okay, so phlebotomy में कैसे artificial intelligence we can implement? By implementing augmented reality. What is augmented reality? This is a so what can happen in phlebotomy if someone is well trained enough? Now since you are in second year, I will not ask you to raise hand. Had you been in final year, I would have definitely asked how many of you have actually drawn blood from a vein. At your level, I know it is, I cannot expect you to answer this. You must have seen it, but you may not have done it. So problem happens if the vein is very good, prominent, it's fine. One can easily draw blood. But if it's a baby or the vein is not prominent, if the patient is in shock, then there is a lot of problem in just drawing the blood. Analysis chhod do, right? Analysis, diagnosis, that will come later. Even in drawing blood, there will be a problem, right? Especially if someone is not trained enough. So to overcome this problem, AI, machine learning, artificial intelligence have been implemented to innovate this device that is known as AccuVein. Okay, so what it does, this AccuVein is an augmented reality machine. It works on the principle of लिखो reflectance photometry. शॉर्ट नोट आएगा तो यही सब टर्म्स देना है, तभी मार्क्स मिलेगा, राइट? You cannot write anything like that. Reflectance photometry. So reflectance photometry does what? It sends the infrared light and then it is reflected back, right? But the machine, if you just shed an infrared light on your skin, the whole skin will look red. However, the way the deeper structures in our skin absorbs infrared light is not the same. This machine has been trained to display an image if the infrared lights are not reflected uniformly. That is why when veins are absorbing more infrared light, it is basically casting a shadow on its own. Normally if you just shed a red light, वो नहीं दिखेगा. So I have a video for it. So you just see, this is the, I hope the video is visible. So see, just by shedding the light, the UV light, you can see the veins. The vein, it is a real time thing. If you squeeze it, the patency of the vein, everything can be tested, and so it is very much easier, especially for babies, and it increases the patient compliance. The pain of pricking will still be there, but imagine if the vein is not available, vein nahi mil raha, and 2 बार 3 बार we are pricking and not getting blood. That is very frustrating for both the healthcare provider and painful for the patients. And in big corporate setups, in which many of you will be a part of, you can be sued, right? So it's better to have technology and make good use of it. Then so after the collection is done, we are now into the automation in clinical laboratory. So you can see there are hundreds and hundreds of vials. The same thing you will be seeing if you go to our, your central lab at MGM Medical College, and there are multiple samples that are being ordered by the clinician. कोई हो गया glucose का, some may be of urea creatine, some might be of liver function test, some might be testing HbA1c. You are now familiar with these terms. And as per convention, each and every sample, अगर parameter अलग हुआ तो that has got a different color of cap, just to make sure, because the constituents of the vial are different. Some has got sodium fluoride, some has got citrate, some has got uncoagulated, some has got nothing. So we need clotted blood, right? So the separating this whole thing manually there might be error. There should not be error, but there might be error if we are doing it manually. Okay, so we need automation, and automation has been done. So what is the definition of automation in clinical laboratory? इसको note करना. You don't need to write because you'll be getting the slide. You should have some idea. You should be able to write the definition in your own words, right? So the process whereby an analytical instrument performs many tests with only minimal involvement of an analyst. We will be standing next, especially the technicians, the trained healthcare providers will be standing next to the machine. They will be doing the minimal, some touchscreen commands, and the rest the machine will be doing. Maybe he or she only enters the name and the information about the patient and what test needs to be done. Rest will be done by the machine. So it is achieved by controlled operation of an apparatus, process or system by mechanical or electronic devices without human intervention or with minimal human intervention. I would suggest, so see, these are all definitions from different published literatures. The best way in today's date to write the definition of automation is to use the term minimal involvement. Whenever you are writing, intending to write without any human involvement, usko change kar do, minimal human involvement, because there are teachers, there are scientists who do believe that AI can never replace human, and you might be infuriating them without even knowing. If you say that your job is done, right? So we don't need to go into that controversy, especially in Viva. Always answer with minimal human involvement or minimal involvement of an analyst. Now automation to ho gaya. Next step is intelligent automation. So how do we do that? Now comes the role of the softwares. So in the programs, in the machines, there are softwares who can monitor and respond to any problem. If the machine is having any problem, it's not that the machine is stuck. We need to go and identify, okay, where it is stuck, what is the problem. The machine itself will give you some error. Simply in your computer, flag about an antivirus is actually an artificial intelligence, right? Similarly, the same thing happens in automated analyzers. So the repetitive task machine performs by itself. Once in intelligent machine, if we just type the term renal function test or RFT, it will do multiple tasks. So, urea, creatinine, cystatin, all those parameters which are predefined for kidney will be automatically done. So what point you should write? Intelligent automation in clinical laboratory or intelligent automation in automated analyzer. So okay, I hope till now it's clear. कोई एक respond दो. समझ में आ रहा है? Right. So fine. So we move on. All right. So advantage, even without looking at the slide, if I shut off this slide and if I would have been there, I would have asked you to respond and I would have written your responses on board, and then all these points would have already been covered. So what are the advantages of automation? You can easily relate. बहुत सारा sample, thousands and thousands of samples. So it can be done in a much shorter time with minimal human involvement, means processing of larger load, reducing number of staff, because staff is also overburdened. Kajal has to draw the sample, he has to work, he has to go and do the practicals of your juniors. I'm just giving a vague specific example for your situation, but it is how it is, right? So if we have got a machine in which he gives command in the morning, ye sare test karke rakho, in the meantime he is going and doing the practicals, again he is coming back and he is calculating, getting the results. It's much easier for the management to get all these things done, right? Moreover, reduction in the variability of result and error. Whenever we are allowing precise machine to take over, there are areas, especially in clinical chemistry and laboratory, in which if human is doing the thing, he or she might be very skillful, very accurate, right? So I know, for example, again, biochemistry, MJ Medical College, I will again give example of Kajalda. So he is very accurate in what he does. But imagine he is doing the same thing over and over again, 1000th time, from morning 9 AM to 5 PM. At 5 PM, at 4:30, he is bound to be fatigued. है ना? तब all the errors आएगा, and the machine does not do that. So in repeatability, and intervariability of this result, again wherever there is AI and automation, it is helping in laboratory medicine. And what it does, ultimately it helps in improvement of the quality of lab tests. Means what? If you are having some problem, सैंपल अपना कॉलेज में दो, द रिजल्ट आएगा, यू कैन आंख बंद करके रिलाई अपन, यू डू नॉट नीड टू गो टू शिलीगुड़ी एंड गेट योर टेस्ट डन इन SRL, राइट? यू नो व्हाट आई मीन. And ultimately everything reduces the cost. So these are few of many advantages of AI and automation in clinical laboratory. These are the clinical chemistry analyzers. देखो, why I have given these two machines, the name of the machine is Selectra Pro S and Selectra Pro M. I don't know whether you have been taken to the central laboratory as a part of a early clinical exposure in first year. गए थे? How many of you have been there? If not, now please do take your time, because it's also a part of, it's never too late. वहाँ पे जाओगे तो एक साथ you can view all the labs, how things are getting done over. सब लोग एक साथ मिलके मत जाना, because there is already a lot of crowd. You can go in small batches just for your own curiosity. And if you go there, biochemistry laboratory में you will find two machines. One is Selectra Pro S, वो छोटा वाला है, and one is Selectra Pro M, वो बड़ा वाला है. Those two machines are lying side by side and they are doing all the tests one after another, day and night. So you can go at night, रात को भी चलता है, right? So this is about automation. And ये सारा machine में there are softwares which have AI modules implemented that will give you an error flag, that will ask you to recalibrate the machine अगर कोई error दे रहा है. So all these things are automatically taken care of. The only thing that the human, or where is the room of minimal human involvement, I told you, is just inputting the name. Patient का नाम डालो in via keyboard, right? Where from someone will get the patient name? Generally in all good hospitals there is something known as laboratory information system, that is also there in MJ Medical College. So basically it's a software in which all the patient's data are stored. So any previous result we can easily correlate. Suppose आज I have given my sample of fasting blood glucose सुबह 8 बजे बिना कुछ खाके, and my report comes to be 129. Tell me whether it is good or bad. Fasting blood glucose 129 mg per dl. Very bad, because anything above 126 is, I am frankly diabetic, right? So the one who is, so machine bolega it's high. So the first thing that the machine does, or it will instruct you to do, the one who is operating, is delta check. What is this term delta check? It means अगर ये पेशेंट का प्रीवियस कुछ रिपोर्ट है तो उनसे टैली करके देखिए. So oh, now I find fine this patient, this Dr. Arindam Ghosh. Why? Because I have a unique identification number. वो भी I will tell you how I get the unique identification number. Is already entered at MJ Medical College. So now देखा कि पिछले महीने oh my god इनका तो 226 था, फिर 2 महीने पहले then it was 156, now it is 126. So means I am responding to therapy. So suddenly this is bad, but it is actually good. So now with the help of this machine and AI, I am confident enough so that I can deliver your report. You get my point? So this is how the human, or the minimal human involvement, is also needed along with the automation, right? And this unique identification number we get by the adding a barcode to the specimen. Now regarding a barcode, this is a basically same thing. You know why I gave the picture of Google Pay or AI at the beginning, क्योंकि you are familiar with this QR code. ये क्या करते हैं? Unique identification number. In case of patients, it identifies the patient number, the serial number. In case of blood vials, the unique barcode can identify the type of vial. So anything which is unique can be identified by the machine. If we are giving these vials in the automated machine, the machine will automatically know, okay, I have the gray cap vial, then I need to do the blood glucose analysis. Alright. So again, I am not going into detail of barcode. What is important is initial labeling of the patient. Because why I'm not going to detail, because it's easier for you to understand the barcoding thing. So while labeling the specimen, then also we give a barcode, right? You have seen पहले if you go to gynecology and obstetric ward, you will find this thing. पहले के ज़माने में क्या होता था? We used to give a number in the baby's arm, and that same number was handed over to the mother, and the mother know my baby's number 39, and then the mother becomes goes to a toilet or anything, she becomes disoriented and 39 का 38 हो गया, and then 20 साल बाद दीवार मूवी हो जाएगा. So we are not going into all that, we are not relying on all those things, right? So we have got these barcode which are unique, and इसी barcode में every information. So once at the laboratory information system interface, I scan the barcode and I get every information. So barcoding, mind it, is the first step, because it's the first step in identification of the patient. ये अगर सही से नहीं हुआ तो all the automation will fall over. So all AI will cease to exist. The first thing is the implementation of barcode. So again, अगर question आता है AI in laboratory, so intelligent automation, AI in software, barcoding in sample identification. This is also a key point, bullet point, जिसके ऊपर आंसर लिखना है. Mind it, even if you know everything, if you write a big essay type answer and your friend also knows the same thing and he or she writes bullet points underlining everything, he or she is bound to get more marks if the exam is actually theoretical type. You may say why it is not fair, because I also write the same thing. It is all about representation relativity. A good, well represented copy, whatever is the question, automatically creates a good impression for the examiners. And हर question में एक दो करके ultimately he might cross the line to get honors, and you might be stuck on the borderline. So that is not good. So bullet points करके लिखना. If the question is AI, barcoding should be one bullet point. And again, barcode is of two type. One is one dimensional barcode. ये तो हम लोग हमेशा देखते हैं. If you buy Pepsi today or tomorrow, देखना बॉटल के पीछे ऐसे लिखा. So these are simple black lines by which simply tells the numbers. So you just give a scan, एक number आ जाएगा. You go to Spencer, More, whatever, right? You will get all these things. And there is a two-dimensional barcode right now, which is implemented. One dimensional barcode का ज़माना गया. So in two dimensional barcode, not only the single dimension, the more information can be incorporated. So we can not only identify the nature of the patient, we can basically, the more information, the more data we are entering into the patient identification, the more unique and specific will be, so that the patients cannot be confused, the reports will not be confused. Fine. So barcoding is one aspect of automation. अब we are, so identification हो गया. So traditional में क्या था? So AI देके blood draw किया, right? AI देके label किया manually, so that AI can be implemented. The next step is delivery of the samples to the laboratory, because blood sample कहाँ पे लिया जाता है? For the patients who are in outdoor, or they might be going to the laboratory. However, the patients, the main bulk of the patients who are admitted, they will not walk and go to the lab, right? So their sample needs to be collected at bedside, and they are needed to be sent to the lab. And उसके लिए भी एक आदमी चाहिए, वो लेके जाएगा. एक आदमी अभी लेके गया, then in the next 1 hour, again a lot of samples are being accumulated. So what happens? In general, it should not happen, but if there is a shortage of staff, the same person decides, okay fine, I will wait 2 hours, 2 घंटा wait करेंगे. In 2 घंटे में whatever samples I have, I will take to the laboratory. So that does not happen. So what happens? The patient जिसका sample 2 घंटे से wait किया, his or her parameters will be changed, right? So we need automation and AI in specimen delivery as well. So these are the 3 ways in which AI has been implemented in specimen delivery from bedside to laboratory. Alright, pneumatic tube, electric vehicle and mobile robot. एक का एग्जांपल पहले देख लेते हैं. न्यूमेटिक ट्यूब क्या है? ये बेसिकली these are channels or tubes through which you can send a specimen from anywhere to the lab. फिर से एक छोटा वीडियो देखो. So here the analyst has drawn sample from the bedside. See, he is scanning again. उसका भी एक identity का भी barcode है. He is entering a code where he will be sending the samples to lab analysis. Right? This is in different language. So he is saying yes, and then he is just entering the whole thing, the chamber or the cylinder sort of thing into the tube, into the machine. खुद को नहीं जाना पड़े because you can focus on his duties. He doesn't need to walk to the lab. And देखो sample चला गया, and it's simply just like a, what you can say, a roller coaster or a slide that you see in, देखो. So the sample is going. These are done by blowers and vacuum. So it can go from anywhere to anywhere. देखो, so suppose it needs to go from first floor to second floor. So we can change the channel. So who is deciding all that? Software and AI. अगर कुछ problem हुआ गड़बड़, so it will auto correct itself. So now the sample has been delivered in the laboratory, and laboratory में analysis होगा. So the analyzer, the person, the technician who will do, he will simply open the thing that has been delivered to him, and you can see all different types of sample from everywhere can be analyzed. So he has now, whether it is blood culture, whether it is anything, but the one important thing is the empty reservoirs needs to be sent back. एक चीज देखो, since the sender had to specifically send it to any the laboratory, he had to give code, etc., everything, right? But laboratories, you just send the vial. We don't need to do many things. So vial
recording in progress.
चला गया, right? And it will go. So this is one mode of delivery of. So where AI is implemented? AI is implemented in the channel, in the delivery. If anything goes wrong, it will give red flags. It will give alarms. If a vial goes out of track, it can self-correct. So there lies the automation in clinical laboratory and the AI in clinical laboratory. So I'm not showing video of all of that. You can visualize same thing. Monorail track पे काम करता है. These electric vehicles, again we are loading all these samples, same with mobile robots. So we can program them. Everything, anything which is programmable has got an AI hub. We can program them. We can give these robots a destination and they can simply go and deliver it. So where pneumatic system is not possible, where there are multiple levels, CD चढ़ना है, then pneumatic tube is a must. If it happens in the same level, then all these mobile robots can be implemented. Fine. Excuse me. Next is automating pipetting station. The example I gave you is a technician who is doing the same thing over and over again all throughout the day. Will have fatigue at some point of time. So we need to negate that. So we have installed, we have got automatic pipetting station जो अपने आप उठाएगा, अपने आप dispense करेगा. There are multiple areas in which these are implemented. They are easy to program. So software है, program कर सकते हैं. It will self correct. कोई अगर if bubble comes, it will again dispense and again उठाएगा. So there lies the AI. So it is thinking like human, right? It is deliver. ये देखो एक line यहाँ पे लिखा हुआ है. So number one, easy to program, rarely malfunction, that is known. So delivering aliquots with precision and accuracy. Aliquot क्या है? Aliquot, the term means small portion of a large sample. लिखो, small portion of a large sample is known as aliquot. Small portion of a large sample. याद है फर्स्ट ईयर में you had a big jar of urine sample, glucose and ketone में टेस्ट करना था, उसमें से you are given in a small beaker छोटा छोटा amount, right? So that was not very specific because it was qualitative test, but for quantitative test we need to make sure each and every reagent tube gets 25 microliter of a reagent suppose, and wo machine will do much better. So these automatic pipetting channel which are equipped with robots and AI have been implemented in many situations. Automated nucleic acid extractor, पहला दो तो you must have heard, automated RNA extractor and automated RT-PCR machine कहाँ पे यूज हुआ है in the last 5 years? बहुत जगह पे यूज हुआ है. In which disease? Absolutely, in COVID-19. COVID-19 actually revolutionized the need of AI. जो सब लैब में मैनुअल होता था वहां पे भी AI चालू हो गया. नंबर 1 क्यों? To make sure the result are accurate, and number 2 डर के मारे people are not going into the lab. So बोला कि हाँ भाई मशीन चालू करो, हमें नहीं करना है. Right, so all these are all the two sides which ultimately led to a good thing. So again there are multiple next generation sequencing analyzers, high throughput proteomics, बहुत कुछ है यहाँ पे. We are automating the AI in laboratory. So this is how a total laboratory automation works. Again it's a big topic. वो सारे 18 points that I showed you in the first, एक point का automation है. So basically we are loading the thing and then we are done. सारा centrifugation, capping, uncapping, everything will be done in the machine, and ultimately 1 or 2 people can process thousands and thousands of sample in matter of half an hour, and that's a huge thing. And in every step there are AI which are helping the technicians, and there are the technicians commands which are also helping AI to understand. So it is one learning with other. Fine. अब we come to the final part of our discussion, that is point of care testing analyzer or POCT. अब क्या है ये POCT? These also have different names: near patient, decentralizing tests, off-site testing. मतलब the traditional, see how we are now, again we are going one step ahead. पहले तो lab, we have discussed how lab में automation और lab में AI, because patient आ रहा है, patient का sample draw कर रहे, we are sending the sample to lab में test हो रहा है with AI, reports हो रहा है with AI, patient doctor को मिल रहा है with AI, right? Everywhere there is software, there is AI. वो भी काम का नहीं है. We need better. This better is POCTs. Patient आया, sample collect किया, there is a machine. We are avoiding the lab altogether. Sample is not going to the lab. Patient के बगल में, near the patient, there is a machine जहाँ पे एक drop sample दिया, तुरंत result आ गया. Then we can decide क्या करना है patient के साथ, whether it is done at bedside at the hospital or whether it is done at home by the patient or by the individual itself. Everything is point of care testing. If I ask you, आप लोग भी बोल पाओगे, 2-3 एग्जाम्पल तो इजीली बोल पाओगे पॉइंट ऑफ केयर टेस्टिंग. देखो, दिस इज एन एग्जाम्पल ऑफ POCT. ये है एक lateral flow. These are known as lateral flow assay. Have you seen this type of devices? These are used, there are many types. COVID rapid antigen, यहाँ पे आप अपना सीरम सैंपल डालो, रिजल्ट आ जाएगा. AMI, एक्यूट मायोकार्डियल इंफार्क्शन डायग्नोस करने के लिए ब्लड सैंपल डालो, ट्रोपोनिन T के लिए, ऐसे ही रिजल्ट आएगा. यूरिन सैंपल डालो फॉर प्रेगनेंसी टेस्टिंग, सेम प्रिंसिपल. ऑल ऑफ दीज आर पॉइंट ऑफ केयर टेस्टिंग. एट द पॉइंट ऑफ केयर वी आर टेस्टिंग, वी आर नॉट सेंडिंग द स्पेसिमेन टू द लेबोरेटरी. सेम बिलीरुबिन, छोटा बच्चा है, कौन इतना ब्लड उसका खींचेगा, 1-2 बूंद आएगा, दैट विल बी सेंट टू द लैब से रिजल्ट आएगा. सो वी हैव गॉट दिस ट्रांसक्यूटेनियस बिलीरुबिन एनालाइजर. बस लगाओ स्किन के ऊपर, विदाउट एनी प्रिकिंग विल गेट द बिलीरुबिन रिजल्ट. आर दे एक्यूरेट? यस, दे आर एक्यूरेट. कैसे एक्यूरेट हुआ? इनिशियली व्हेन दे वर टेस्टेड दे वर नॉट एक्यूरेट. thousands and thousands of times टेस्टिंग करके वी हैव made the machine learn, okay, इसका reflection इतना आ रहा है, means bilirubin will be that, and now the machine has learned using AI and ML and deep learning neural network, तभी जाके it is now in today's date very accurate and sensitivity is almost same as drawing intravenous blood. That is why invasive bilirubin testing for screening is now out of the question. हम लोग सभी ऐसे transcutaneous bilirubin analyzer यूज करते हैं. It has got AI built into this machine. ये तो आप सब लोग जानते ही हो, राइट? ग्लूकोमीटर, सुई चुभाया, ग्लूकोज लेवल आ गया. अब इसमें कहाँ पे AI है? फाइन, देयर इज अ केमिकल रिएक्शन दैट इज हैपनिंग. AI comes when we are coupling this with an insulin pump, and then this whole thing becomes what is known as artificial pancreas. Pancreas क्या करता है? It senses the level of blood glucose and it releases the insulin hormone, right? For the normal cases, diabetics जिनमें इंसुलिन नहीं है, what they will do, instead of patient remembering to take a dose every time, you just let the patient go. Patient does everything on his own or on her own, and then the machine senses the glucose level, right? There is a subcutaneous glucose sensor. It will wirelessly send the data to the insulin pump. There is a patch, and then insulin will automatically get released. Very important. AI, right? Artificial pancreas. Very, very, very important. Affordable for the healthcare system, especially in Western countries. We are now left with very few slides. अब देखो, when we are talking about early detection of diseases, we have to use this thing. This is a schematic model of deep learning. Deep learning क्या था? Deep learning is a type of machine learning where the machine mimics human brain, learning way of human brain. So there are multiple networks. So one layer se the information goes to another layer se goes to another layer. So this is known as neural network. So now what happens if we go for a genotyping of say thousands of patients? Even in first screening, the machine itself will tell us the probability all these patients might have these diseases. It's a huge thing that we were not able to do a few years earlier, right? And now we can get hold of these patients. So these are predicting a probability, early detection and predicting, right? Then we can only test those patients, and we will not screen rest of the patients for say depression. ठीक है कि बाकी सबको टेस्ट करने जाएंगे तो there will be a lot of cost involved. So early detection screening program, AI has got a huge role. So ultimately what is happening is the patient or the case or the subject, जो भी बोलो, normal individual or self-aware individual who is doing a health checkup, घर बैठे मोबाइल में कुछ टेस्ट किया, he or she might be needed to provide a drop of blood, वहीं पे रिजल्ट आ जाएगा, वहीं पे उनको प्रॉम्प्ट आ जाएगा, वहीं पे there might be an integrated पोर्टल जहाँ पे फिजिशियन को कॉल जाएगा, फिजिशियन का अपॉइंटमेंट वहीं से हो जाएगा. यू डोंट नीड टू डू एनीथिंग. जो सैंपल में जो आया बेस्ड ऑन दिस रूटीन डायग्नोसिस, कुछ गड़बड़ हुआ तो यूरिक एसिड ज्यादा आया तो यूरोलॉजिस्ट का अपॉइंटमेंट अपने आप हो जाएगा. एंड दिस इज एक्चुअली हैपनिंग, राइट? सो दिस इज एक्चुअली नोन एज precision medicine. Okay, so precision medicine means the concept is I won't take a single medicine that is for everyone. I will have my personalized treatment. Precision medicine, personalized therapy is the machine or AI is analyzing everything about me and giving me very specific treatment which I need only. So that actually prevents a lot of side effects, and that is actually revolutionizing the healthcare. Now, being part of Indian Institute of Technology Kharagpur, this is one of the premier institutes which is into developing all these healthcare innovations, and personally I am part of many such projects. One is COVID-RAP, which was a revolutionary rapid diagnosis of COVID. Now we are working on smart bandage. So a bandage, it automatically predict in advance whether the wound is going to be infected or not, and अपने आप antibiotic release करता रहेगा. So minimal antibiotic, minimal side effect, right? Again, non-contact monitoring of vital signs using radar. पेशेंट के पास जाना ही नहीं पड़ेगा, दूर से पेशेंट सोया हुआ है, everything is monitored and अपने आप वहां से पेशेंट का breathing rate, everything is being told. अगर पेशेंट के पास जाना पड़े भी तो स्टेथो लगा के हार्ट रेट नहीं काउंट करना पड़ेगा. There is a smart stethoscope which will count it. It has been programmed in such a way, it will count, it will display the heartbeat, it will display any murmur, right? So all the autism spectrum disorder, autism is a big thing that is undiagnosed in school going children, right? So simple mobile app parents को दो, ask the children to play all the games interactively, and then उस पे एक स्कोर आएगा, स्कोर कट ऑफ से ज्यादा हुआ, then automatically neurologist का अपॉइंटमेंट जाएगा पेशेंट के पास. So all these things are being done, and all these are revolutionizing the AI in healthcare, and very soon we will be achieving these state where there is a medical bay, right? One of this picture is real, right? And the other two is AI generated, where the machine or the robot will be aware of our system and without or with minimal intervention. And believe me, this is actually happening in International Space Station ISS as I am talking. So minimal human intervention pe he or she is doing the very or not only basic but the advanced thing, implementing robotics and AI. So that's it for today. I'll stop here, and there's a lot to discuss. Maybe we can discuss again in another session. So I thank you all for your kind attention, and feel free to address your any query to my email ID. So that's it for me today. I hope I am on time. अच्छा लगा कि नहीं बोलो, respond. Good.
Thank you so much, Arindam. And it was really a pleasure for all of us to listen to you. And I hope the students have also benefited from your session. And we hope to, we hope to hold such sessions again in future, and hope to, make you join again in future for such sessions.
Thank you so
thank
much.
you very much.
I'll be waiting for that. All right. Thanks a lot.
Thank you. So we are leaving then?
Yes.
Arindam?
Yeah. Bye bye.
Thank you.